Assalamu alaikum. This paper is a case report of a presentation and a non-surgical endodontic treatment of two patients with X-linked hypophosphatemia. So in this case report, we'll describe two patients with X-linked hypophosphatemia presenting with a spontaneous sign of pulp necrosis and endodontic infection in multiple intact teeth. The X-linked hypophosphatemia, XLH, is known as rickets or vitamin D resistant rickets. And it is X-linked dominant genetic condition caused by a mutation in activating the PHEX gene responsible for phosphate metabolism. And this leads to reduced phosphate reabsorption in the kidney, causing hypophosphatemia and impaired mineralization of bone and dentin. And in these conditions, the patient might present with dental abnormality and complication both in primary and permanent dentition. And radiographically, they found a range of abnormal morphological features that present including large pulp chambers and pulp horns, large root canal and short roots and open abscesses. And histologically, the enamels had occasionally a thin and micro crack extending to the amylodentinal junctions. And also histologically, these defects within the dentin is filled with microorganisms. So in this case report, the root canal treatment was the treatment of choice of the multiple teeth that having pulp necrosis and endodontic infection. In the first case is a 16-year-old male patient complaining from discharge sinus associated tooth number 21 and medically confirmed had XLH, and also the dental history revealed the recurrent dental infection in the primary dentition also. And also the family history revealed a maternal linked to XLH, and also the family having an episode of dental infection and tooth loss. So in tooth number 21, having apical swelling and a draining apical sinus and a grade 1 mobility, a negative response to the cold test, and radiographically have unusual coronal anatomy with a wide canal space and a preapical radiolucency. So diagnosed as pulp necrosis and chronic apical abscess, and was treated as root canal treatment with the MTA block. And after 3 years, the same patient was re-referred after development a second spontaneous dental abscess associated with the tooth number 43, and was treated with the root canal treatment also. The second case is a 26-year-old man was referred for treatment of two molars with open abscess and abscess, and he and his family was confirmed having XLH and also having multiple teeth present with abscess and pulp necrosis, which is tooth number 24 and 46, and tooth number 26 having a fractured tooth. So root canal treatment was decided to treat these teeth. While treatment in 2015, a sinus was noted associated with the tooth number 22. So at this point, we decided to do sensitivity testing for full mouth and find 5 teeth that don't respond to the electrical pulp test. But the intervention was not decided at that time. And following the completion of the initial treatment plan, the patient re-attended in the September 2018 with a new complaint of pain and swelling, but this associated with the 6 teeth. As you can see here, this is the complaining tooth, while this is also the teeth that's having trifurcations, and this is the lower anterior teeth having intact teeth but are present with the sinus, drainage sinus, sorry. So what we're learning from these case reports, that a patient with X-linked hypophosphatemia may present with a spontaneous sign of pulp necrosis in multiple teeth in absence of care as a trauma. And this is diagnostic challenges and abnormal morphological features. So the outcome also demonstrates that appropriate root canal treatment protocol, including apexifications or root canal treatment, can implement it successfully in such cases. And thank you.